Welcome to the Tenet Healthcare Medical Minute. I'm Julia Yarbough. Today's topic, the obesity epidemic. Why are children particularly vulnerable to it and how to combat it? Our guest today is Dr. Robert Cywes, a board-certified general and pediatric surgeon. He specializes in childhood obesity. Dr. Cywes practices at Tenet's St. Mary's Medical Center and Palm Beach Children's Hospital. Dr. Cywes, thank you so much for joining us.
Thank you very much, Julia.
So when we talk about childhood obesity, is this an epidemic that we're seeing in our country and around the world?
Around the world, particularly in the US, but now more and more in emerging countries, obesity is the commonest chronic medical illness that exists.
Is there a way to educate parents so that their children don't fall into that pattern?
We have to come to terms with the fact that obesity is not a weight issue or a food issue. It's a substance abuse issue. 20, 30, 40 years ago, the diet of emerging countries was food that used to be alive. You could look at a piece of food and tell which plant or animal it came from just by looking at it. And that is the food our bodies were designed to eat. A few prominent doctors in this country decided, with no factual basis, that fat was bad for us and caused a lot of problems, and therefore they started removing fat from the processed food. What did they add? Sugar and starch. Sugar and starch is a highly, highly addictive substance, equally addictive as nicotine, as crack cocaine, as alcohol. The majority of the obese children that I treat, 70 to 90% of their total calorie consumption is some sort of sugar or starch. And that means they're not getting enough fat and protein in their diet, so not only are they heavy, but they're malnourished as well. The consumption of sugar immediately affects your blood pressure. You become diabetic or pre-diabetic. You get sleep apnea. In the girls, they get polycystic ovarian syndrome. It increases cancers. It has toxic effects at ingestion. All human beings have to take care of their emotional needs every day. There really are two ways to do that. You can either do something that makes you feel good, or you can consume something that gets you high, that releases those endorphins. Work with your children to develop a diversity of action-based endorphin-releasing mechanisms. It could be physical activity, but it could be acting, it could be reading and writing, it could be painting, it could be photography. It doesn't matter what that release is, but we all need a place to escape. For an obese kid, that's the fridge and the pantry.
From a medical perspective, childhood obesity can be reversed. It can be turned around.
Absolutely, childhood obesity can be turned around, but unfortunately, it's going to take a huge amount of effort.
You've given us some wonderful information. Thank you so much, Dr. Cywes. We
You're
appreciate
welcome.
it.
Thank you.
And thank you for joining us. I'm Julia Yarbough. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.